Hello everyone, I am Dr. Neil, your host, and today we have Dr. Awani Shah. She is Regional Medical Advisor, Oncology in Dr. Reddy's Laboratories. She has a vast experience and knowledge in the field of medical research, and today she will break down the steps of how to publish your medical research and how to go about it. So let's welcome Dr. Awani Shah. Hello everyone. For the today's episode, we have Dr. Awani Shah. We'll discuss with ma'am that why publishing a thesis is important and what steps you should follow to publish your thesis. So, ma'am, just to open the talk, so can you just throw some light that why a resident should publish his or her thesis on the first place, and how does the publications impact the career?
Right. So, firstly, before I answer this, thank you so much, Dr. Neil, for
Mm,
inviting me for this podcast. I think this is a very relevant topic nowadays, not just for residents, but for everyone. Just a disclaimer I would like to give, as I work as a regional medical advisor in oncology therapy area with Dr. Reddy's. I just would like to give a disclaimer that all the opinions and views that I'll be speaking on this podcast this evening are my own, and it's not any of with my organization. So with that, let's begin with the first question which you asked, which is a very very relevant question. That I understand your thesis is a requirement, but publication, I would say it's an investment. So it's the difference between doing a research and showing the world that you can do a research. So a publication basically changes how an interviewer sees you. So it's a signal, I would say, of discipline, curiosity, and credibility. It's not just that, a mandatory requirement just to complete your MD, but wherever onwards you go, whether it's in academia or industry or you do any fellowship, publication will impact in a great way and in a positive way. And honestly, I'll tell you, I still remember when I was in my first year of MD, I published my paper, and just seeing my name and seeing Shah et al, Googling my name and seeing Shah et al published there. Honestly, that first publication is like lightning a spark. So once you see your name indexed, you realize, okay, I can contribute to science. So that's why I would say that it's very important, not just a requirement.
Yes, ma'am. So what happens? So let me tell that what happens with most of the residences. The enthusiasm is very much high when they start the research, but as they are done with their results and as they are completed with the thesis, I think the enthusiasm kind of fade away. So,
Agreed.
as rightly said, that publication is very much important, but we'll dive deeper into it. So, can you tell us that where should residents should think about publications, or how to maintain that enthusiasm throughout the thesis and also beyond thesis till the publication?
Well, if you ask me the best time, I would say if I had the right guidance at that time, which I lacked, and now I would like to emphasize that with all our residents, that the best time to publish or think about publish is much earlier than you think. So ideally, at a topic selection, because if you choose a topic no journal cares about, then no amount of stats wizardry can save the paper. But like me, if you have missed the bus right now, if you're in say if you are a GR2 or GR3 and you are about to complete your research, better late than start. So even if you miss that bus, start during data collection at least. And publication is not a last minute activity, it's a parallel process. So I would recommend start as soon as you can. The earlier the better for you.
Okay. And ma'am, most of us do write the review of literature for the thesis. So can you explain that what is the difference between the reviews and the original research, and like what is are there any differences for the publication of these studies?
So yes, a review of literature and original research, they are two completely different things. A review of literature is when you have selected a certain topic and you are going back, researching all the available articles on that specific topic, and then you're writing a review about it. While a original research article, whether it's a analytical or comparative or an observational, you are doing a research that is prospectively. But a review article, retrospectively, you are going back, you are researching all the relevant articles on that topic, and then you are writing a review about it from your perspective, depending on what you have hypothesized, right? So these are two different things. And also I would like to say that when you're doing a publication, important is to read the author's guideline, because whether you are trying to publish a review article or original research article, each type of study has a different guideline. So it's important that you go through that, you read the author's guideline, you um, write your manuscript accordingly before you publish that article or that manuscript.
Yes, yes, ma'am. But well, I think the question is, does the narrative review like count as the publication in my CV? So can I add the narrative reviews as
Of
my paper
course,
published? Okay. Mm.
of course. But I would say, if we're speaking in particular for MD perspective, I would advise to go for an original research article. It has more weightage, and it will speak volumes for you. Original research article, obviously, it's anytime better than a review article or a narrative article. If you see the pyramid triangle, original research article, it has a lot of weightage to it. So I would say while you're pursuing your MD during your residency, you have that, I would say, liberty, or you have that thing that you can perform an original research article while your institute is associated with a hospital. So that is all the time better than a narrative article, I would say. So even when you go for a paper or poster presentation, the weightage will be given more to a original research article.
Yes, sure. Ma'am, so let's come to the original research. So we all are doing the research which is maybe on animals or maybe on the patients that we are recruiting. So can you just tell us that how should we go about the stats? Should we outsource it or should we try to do it ourselves? Should we learn all the softwares and techniques? So can you just guide us on that?
I would say, see, each research article, whether it's an animal study, a comparative study, or an observational study, they have a standard guidelines to follow. Suppose for an animal study, there is an ARRIVE guideline, then there's a PRISMA study. So each study has a guideline, which I would say you should adhere to it, follow it, and go step by step. It will be easier for your publication when it gets peer reviewed. And regarding the statistics part, should we learn it or should we outsource it? I would say you should know the basics enough to not get fooled. But doing advanced stat yourself is not a badge of honor. It would be great if you can learn statistics, know about it, read about it, because it's definitely going to help you. Even when you enter industry, I would say statistics is something where I lack, and if you can master in it, it can be no better while reading, while discussing the graphs with your respective doctors or anything else, even in academia. But while doing your MD and thinking about statistics, I would say outsourcing is okay, but outsourcing blindly is dangerous. So the risk is you end up with analysis you can't defend in Viva or peer review, right? So learn the concepts, outsource the heavy lifting part, but remain the driver of your study. So what I did when I was doing my thesis is I took a help of a statistician from my institute. So while I was driver of my study, she was the GPS. She told me, how to drive your study, which formulas to use, which guidelines to use, um, how to do it. She taught me all that, but I took help of her, because when I had my grand viva, the questions that I was asked, at least I knew what I did in my study and how did I derive to that statistical test, how did I do it. I was asked all those questions. So that's what I'm telling you. If you are outsourcing, the risk is there with the analysis, but you learn the concepts and remain the driver of your study.
Yeah, yes, ma'am. Nicely explained. And I think there are also various conferences and workshops going around to learn these methods. So I think it's always better to learn at least the basics, as you said. So,
I'll
ma'am.
tell you, I'll tell you
Mhm.
definitely, even if you enter industry, like right when I entered industry and in the oncology therapy area, I had a difficult time, initially to interpret how to interpret a KM graph. What is a Kaplan-Meier graph? What is a forest plot? Luckily, one of my colleague who was with me was a DM pharmacology, so he taught me all this. So the thing is, had I learned statistics in my MD pharmacology, this would have been good for me. But that's what I would advise everyone, that at least know your basics.
Yes, ma'am. And I think, as far as I know, stats is also very much like heavy for the interview part of getting into
Yes.
RMA roles. I think most of the questions are based on the biostats, if I'm correct.
Basically, if you clear the first round of interview, then you go to your second, third technical round of interview. They would give you an article to read and make a presentation out of it, right? So while you are presenting, you'll also have to present the graphs. They'll ask you the nitty-gritty of the graphs, or how you interpreted the results. So if you know your stats, that would be really good. That is the challenging part, and that's basically what they're seeing. How can you interpret the results?
Yes,
So
ma'am.
it's important, yes.
So, ma'am, once the results are ready, can you walk us through that how to start writing a manuscript and what are the certain guidelines that we should follow and what are
Right.
basically what the journals demand from a researcher?
Right. So I would say a good manuscript, it's not written, it's assembled. Think of it like a storytelling. So right from the title, I would say that, your title should define PICO. This acronym you must have heard, population, intervention, control, and outcome. Sometimes they add S to it for statistics, sometimes they add T to it for time. So your title should define this PICO, which is the research question, and then think of it like a storytelling, that your introduction, it should mention what gap are you trying to solve. Then your methods, it should mention how do you solve it. Then your results, what do you find. Then your discussion part, it should depict why does it matter. So if your manuscript reads like a logical story, reviewers will instantly respect it. And this is something even I learned in this industry, in this 1 year of my industry experience. I learned that, when you're preparing a presentation, when you're presenting in front of the HCPs, when you're taking a commercial training, if you think like a storytelling, if you guide them through your data through a story, it will keep them more engaging. It will have them remember what you're trying to tell the data, rather than just stating out facts. So I would say, even with your manuscript writing, go or read it in a logical story way, and definitely the reviewers will respect that part.
Yes, ma'am. I think there is a common doubt over here. Let's say when we start writing the manuscript, so like there is a IMRAD framework.
I'm
So
right.
introduction,
Yes.
introduction methods, results, and discussion. So the question or the doubt over here is like how which sections require the referencing and which sections do we have to write by our own, and referencing is not required.
So anything, I would say that you have read an article and you are trying to use that line or that phrase into your topic, whether it's any part of IMRAD, you have to cite it. In
Okay.
methodology section, I would say, suppose in methodology section, that some things, obviously, if what you are doing, what you have done, what you're trying to put out, that would not be cited. But
Right.
I would say, suppose I have done face validation. How did I do face validation? Or how did I validate if I am using a certain set of questionnaires for my KAP studies? So how did I validate those questionnaires? How did I use the reference of those questions? Did I make them up my own? No, obviously I used a reference article to use the question. So that is where you have to cite that those questions is where you referenced from another article, from another study. So it is where you have to decide what is not yours own original you have to cite it, whether it's introduction, methodology, results, or discussion. So in results, basically, you are showcasing your own results, so you do not need a citation over there. But once when you're comparing your results with another study is where you have to cite that study.
Okay, ma'am. So, again, going forward, can you tell us that how to find these good journals? Let's say if I have a study based on pharmacology or some other person has a study based on medicine. So, how to target those journals and how to be sure that these are the good ones and how to figure out which are the predatory ones?
Right, right. So I would say journal targeting and strategy, like journal selection, I would say is like a matchmaking. So if high impact factor journal isn't aligned to your topic, you will they will reject your article within 48 hours. I'll just give you an example. Actually, recently a month ago I had collaborated with one of my KOLs and wrote a review article. So I submitted that article to a journal thinking the keywords are matching with that journal topic. But within 48 hours, my article got rejected because saying that your article topic is not matching with the kind of perception they have. And in fact, my KOL, he only texted me that Avni, the article has been rejected. Don't worry, it's a common thing. Let's move on to the next journal which you have selected. So look for the scope match first, indexing second, and then the impact factor third. So you always have a tier one, tier two, tier three shortlisted. So you don't get stuck after one gets rejected. And secondly, I always advise this when someone asks me which journals should we select. So when you're doing a when you're doing your review of literature, right? So you're going through a lot of articles relevant to your topic, and then you're selecting that either of those articles for your citation. So just see which journal has that article been published because it's relevant to your topic for the reason you have selected. So just see which journal that article has been published, its indexation, its impact factor. So see all those, you'll also get an idea of what kind of journals will be acceptable for your publication. So that is one thing I would like to say. Another thing I would like to say that while choosing a journal, do we also see an impact factor? So I would say not always for your first publication. I would say the goal is visibility and not validity. So a PubMed index journal, which is having a modest impact factor, is still better than choosing a 7 impact factor journal for 11 months and they will not give you a reply. So your publication should move your career forward and not slow it down. So that way, I would say you should see your indexation first, and then you should see the impact factor.
Yes, ma'am. And the great point that you mentioned about the timelines. So so I think if a journal is rejecting the article as early as possible, I think that is a good thing, right? So we have a clear vision ahead. So rather
So
than they just not
basically,
replying.
agreed, agreed. I would say basically the rejection is initially it could be due to technical thing. As I said that it is important first to align your topic and then selecting a journal which aligns with that topic. If they are publishing, see the articles which they have published of the same topics, then you are aligning your topic with that journal. Second thing is author guidelines, right? If I want to publish a review article, I did not see the author guideline for the review article which they have mentioned, the criteria how they want it to be published, and I just submit. So that is where there are chances of rejection because you didn't follow the guidelines they mentioned. Another thing that each journal has its own criteria for each type of article, whether it's original research article, review article, narrative, anything. So they have different criteria. So if you go through those criteria, set your manuscript that way, and then you submit, there are less chances of rejection. So this
Yes.
is the
Mhm.
thing. Yes.
Okay, ma'am. So, like, can you tell about what are the article processing charges and what is the difference between an open access and a closed access journal?
So I would say that APCs, they're not a scam, so they're a business model. So open access journals, they charge APC because they make your article free to the world. But subscription journals, they don't charge you because libraries pay them. But residents should not, they should never feel forced to pay, so there are plenty of zero APCs or PubMed index journals. So that is what, you need to identify the journals and which have good indexations. That is why it's important to have good indexations. And I would say, your key thing is the art. If you are trying to publish your manuscript, go for a PubMed index journals. Some journals, they would ask for a registration fee one time, and then after your article gets accepted and everything, then you don't have to pay anything. Some articles, they already say, like, I think Lancet or any other journals, that once your article gets accepted, and then there is a publication charges. So basically, I think you need to research the journal that you're trying to publish, and see the indexations there, uh, to actually see, some predator journals, they'll charge a very hefty amount, and then they'll say that, we'll publish it in a PubMed index journal, Scopus. Please don't fall for that. They would charge very hefty amount of it. So don't fall for that. Go
Okay,
through
so
the
hmm.
process.
So ma'am, going into it, so how much rupees is a fair amount to pay for a resident? Let's say if I want to publish and if a journal is asking 20,000 or 25,000 or maybe more, so how much should I should I pay it or should I just skip that journal?
Definitely not. I don't know if the journal itself is asking a hefty amount, or a third party is asking a hefty amount. Till date, where I have published in PubMed Index Journal, they have considered, I think, 1,500 for a lifetime membership for that journal. And after that, they have not asked any amount of money for publication after acceptance. So I think you have to be very careful in it. I don't know about international journals. I think international journals do charge, but those journals are very reputed journals. So you have to identify between them.
Yes, ma'am. And sometimes I think we get lot of these messages from random numbers in WhatsApp that you should pay 7,000 rupees and we will publish our research. So I think most of these are predatory ones, right? Because they are just straight up asking for
Yes.
money.
Yes, yes. So that's what I'm saying, that you identify your predator journals, and then you identify the impact factor. So you also see the journals that they're trying to publish your article. What is the impact factor for those journals? I would say go through that. A PubMed index journal with a modest impact factor, still better than choosing a seven impact factor journal, which will take 11 months and will not give you a reply to it. But also you identify those who are telling you that you pay this hefty amount and will publish your journal, your article in a PubMed index journal. Then ask for which journal are they giving you the reference, which PubMed index journal. Is it aligning to your topic? And then you see the impact factor of that journal. So it's very important to
Hmm.
identify that.
Yes, ma'am. And coming on to a very important question or a very important query, let's say if I am doing a original study, which is a cross-sectional study, and if I have some questionnaire or some other parameters, so can I slice it into two papers, or can I divide my data and can I get two or three publications out of the same number of data? So is it ethical?
So ideally, actually, even when I did my dissertation, um, tried to divide it in three parts, but then even I faced this challenge of, ethical issue. I faced this challenge. What I try to do is maximum you see your objectives. What are your objectives? One primary objective, not even secondary. And in that primary objective, can I put that as one paper? Then my secondary objective can be part of the second paper. I would say at max you can divide it into two parts, because of many objectives that you have in your research article. but not more than that, because then yes, ethical consideration would be there. It would not be impactful also. At max, I would say you can divide it into two parts, but not more.
Okay, ma'am. And as you mentioned, some of the journals will take, let's say, 12 months or maybe more to reply. So, can we submit our same study to parallel to some other journal? So, like, is it ethical to submit multiple journals at once?
Absolutely not. So, dual submission is academic misconduct. And, life is very small. The world is very small. So, editors do talk, and one email from them can blacklist you from several journals. So, be ethical and save yourself from trouble. Don't do this mistake.
Yes, ma'am. Rightly said. So, you never know that what are the consequences. So, it's better to follow the ethical guidelines. And also, ma'am, there is again a query from most of the residents. Let's say if I have presented a paper or poster in one conference, can I present the same research in other conference? So is it again into ethical or is it again unethical? What do you comment on
I
this?
would say if it's your own paper, if it's your own research, you may, but if in the second conference that you're presenting, you should give a disclaimer that this was already presented
Okay.
previously. So just
Mhm.
like, when you are submitting your manuscript, they'll even ask you this before submission. Have you presented this paper at any conference or anywhere else? This is a disclaimer that you have to give to avoid
Mhm.
conflict of interest.
Okay,
So
ma'am.
it's not
So
wrong,
mhm.
but you have
Mhm.
to, put out there. You have to clarify it.
Yes. So, ma'am, so I think most of the doubts and most of the questions are covered as far as publication goes. So, can you close the conversation by giving us the advice at how, like, how should the mindset for publication should be and how to go forward, and what should we keep in mind to again end up in a career with multiple publications?
I think some key things that I do want to highlight. First, while you selecting your journals, indexation is very important, right? So, one question is like PubMed versus Scopus versus Medline. So, the simplest explanation for this is that, a Medline, it's the gold standard. It's curated by NLM. And PubMed, that's a search engine that shows Medline plus other approved journals. And Scopus, it's Elsevier's large index, right? So it's great for CVs and citation. So key thing you need to remember that a Medline index journal automatically appears in PubMed, but it's not vice versa. Second thing that I want all the residents to remember is um, register on Orchid. So think of Orchid as your Aadhaar card for your research. It ensures that all your work stays linked to you. So even if your name is spelled differently in different papers, it'll still be there. As I said, Orchid is your Aadhaar card. So create it early. It becomes your research identity for your life, and it's very simple to register. No charges for that. So two things, please remember that. I would also like you to remember that while you're submitting your article, go through the author's guidelines so that the chances of rejection is less, and submission is just not like uploading or clicking upload. You need to have a clean manuscript. You need to have plagiarism report, the ethics approval, the cover letter, co-author approval. So this is the biggest mistake that I've seen, that they do not read author's guideline, they submit and then it comes halfly rejected. So these are key things that I would like all of you to remember. Another thing I would also like to tell you that rejection is not a verdict on your intelligence. Like, it's a scope of mismatch or something minor in methodology. Like I just told you, a month ago one of my review articles got rejected. But my rule is, never mourn a rejection for more than 24 hours. Fix, refine, resend. The fastest published authors, they are not the smartest, they are the most persistent. So while you're in this process of publication, you need to be very patient, be very patient. If your paper gets rejected, that's what I told you. You keep three options, go on to your next journal, publish it, and read the author guidelines for that publication also. And the final thing, also one more thing. So, last weekend I had attended the advanced course in clinical pharmacology conference plus workshop at PGIMR Chandigarh. So over there, one of the industry person, he took a session on. So he took a session on how to register in CTRI and clinicaltrials.com. So to all my residents seeing this, I would like to tell you, before you start your study, please register on CTRI. It is very important. Even our thesis, it is there that you go and register in CTRI. Key thing here to remember is on CTRI only prospective studies are to be registered. So for me, I wasn't aware of it, and no one had told me about it. So I asked this question to sir. So I think his name is Dr. Chintan Khandelwal. So I asked him, sir, now that I know about this to register, but I have not registered, can I retrospectively register on CTRI? So he said, no, on CTRI, you cannot retrospectively register, but on clinicaltrials.gov, you can register retrospectively. So those who have not registered and completed your thesis, please go on clinicaltrials.com to register. Those who are just starting out, please register on CTRI. This will bring value to your manuscript when you publish it. It will authenticate your study even more. So these are key things that I would like to highlight. And don't try to climb the mountain in one day. Just take one simple step tomorrow. Open your thesis file, write 10 lines of your introduction. So that tiny action starts the entire momentum. And publication doesn't happen in one big burst. They happen in small, consistent steps. So be consistent, and that's all I would like to say and advise to everyone.
Nicely said, ma'am. I think this conversation will really sum it up for all the residents out there who are like clueless about the publications. So it will help us a lot. And thank you, ma'am. It was a great session
Thank
again,
you.
and I will definitely stay in touch with you.
Definitely. Thank you. And to all who have any queries or anything, you can please always reach out to me. And thank you, Dr. Neil, for this amazing conversation. I had fun interacting with you. And thank you so much.
Thank you, ma'am.
All the best to all the residents. Yes.
Yeah.